Okay, I'm Dr. Nelson Soucasaux, gynecologist, author of these two gynecology books right here, New Perspectives in Gynecology and The Female Sexual Organs, Shape, Function, Symbol and Archetype, published 20 years ago, and already known of you here in the YouTube. At least, I suppose so. As I did in my last talk here on the subject Gynecology Becoming a Gynecocracy, I decided previously to write down some notes so that I don't forget anything, and also for not getting lost in my speech. If on the one hand there is a lack of spontaneity, on the other there is a great gain in precision. And whenever I'm exposing my points of view, precision is the most important thing to me. Now, I began with a question. Is there anything else really interesting to be done in gynecology? Obviously, except continuing with the usual technical advancements in a gynecology that became exclusively restricted to a technique. Is there anything else really interesting and intellectually stimulating to be written on gynecology? But thinking better, in a gynecology eternally dominated by surgeons and obstetricians, what can we expect? Can we expect something else? For decades I have been struggling for separating gynecology from obstetrics and surgery, but my fight has been unsuccessful. That's terribly frustrating. After having dedicated 42 years of my life to gynecology, I began when I was still in the second year of medical school, and now counting 38 years of gynecology practice as a medical doctor, having published 2 gynecology books that were misunderstood and persecuted. Yes, they were persecuted. Many articles published in medical journals and in the last decade on the web. I have to confess that I'm exhausted. I'm exhausted. Even so, I continue working in my office and assisting some patients. But this only as the present day hellish and damned medical system that destroyed medicine here in Brazil allows me to do. But gynecology is an addiction, as well as medicine in general. And now making use of a phrase by a character in the last Stanley Kubrick's movie, Eyes Wide Shut. This character was a medical doctor. Was a gynecologist, always a gynecologist. So let it bleed. On the other hand, I think there is nothing significantly new in present-day gynecology. There is nothing significantly new in present-day gynecology. To my view, the specialty could even be declared dead as a consequence of its own stupidity and blindness, and plus a terrible disinterest on the part of the patients due to lots of misunderstandings accumulated along decades and decades. Yes, I said disinterest on the patient's part. And regarding these patients' misunderstandings, they are the result of gynecologists' own misunderstanding of women, gynecologists' own misunderstanding of women, and of what the specialty really is about. Well, slight break. Now, another question. Okay, I apologize, women, but who actually understands them? Do they themselves understand themselves? What do women want? I'm not a Freudian. I don't like Freud. But I have to agree with him when he raised this question in the beginning of the last century. What do women want? Presently, the only approach to gynecology that intellectually stimulates me are the psychological, sociological, and political aspects of women's medicine. In a gynecology almost totally ruled by technological, statistical, crazy epidemiological studies, and divided into lots of subspecialties, the only very interesting and important thing I have seen lately were the first amazing and wonderful photographs of the ovulatory process ever taken, recently published. As to scientific gynecology writings, and that concerns me deeply, the so-called evidence-based medicine, with its astonishing epistemological blindness and arrogant ignorance, is destroying all creativity, originality, and personal approach in articles on the specialty written for medical journals. So, once again about writing, for someone like me, I ask once again, presently, is there anything actually new, interesting, and intellectually stimulating to be written and published in this very weird specialty named gynecology? Sincerely, I don't think so. But if people may think I'm getting out, I'm leaving, no, they are absolutely wrong. I'm not getting out, I'm not leaving. Much on the contrary, I continue on my way in my struggle. Though deeply disappointed and tired, I will never give up. At least up until this strange and mysterious thing named gynecology is definitely considered dead and banished from the world. That's it. Thank you very much. We can finish right now. Okay.